Hello, everyone, and welcome to tonight's PDN Live. I'm your host, Shannon, and tonight's topic is emergency medicine. And I want to thank you all ahead of time for your questions. If you have any questions during this live feed, please ask in the YouTube feed below. Like I said, tonight's topic is emergency medicine, and with us we have Rob Pincus, the Executive Director of Personal Defense Network, and Caleb Causey of Lone Star Medics. So before we get started, Rob, you've been very busy lately with NRA meetings and the Personal Defense Network tour. Do you want to get us caught up to speed on what's going on in your world?
Yeah, I was actually getting Instagram caught up on Caleb's.
And tonight's topic is emergency medicine. And I want to thank you all ahead of time for your questions.
What's happening?
If you have any questions during this
I gotta. All right, that's better. So I was so busy that I was watching this podcast with a 5-second delay in another window while Instagramming. Yeah, so the tour is in full swing. I think we had probably just started the tour about the time we did this last one with Mike Seeklander, and I think I was down in Florida, and now I am at my Western HQ in Colorado. I'm actually taking this week off from the tour. My daughter is getting married in a few days, but I was just teaching in New York State, just outside of Manhattan, which was awesome, in kind of occupied territory there, the heart of anti-Second Amendment America. Great range there, Pioneer Shooting Center. Love going kind of behind enemy lines and teaching for the people that are jumping through all the hoops and fighting the good fight in New York, New Jersey. I'll be in New Jersey teaching next week. Massachusetts later in the year. Of course, we go to California, wherever. It's easy to run a class down in Kayla's backyard in Texas. Being able to get people together and actually find venues that are willing to host true defensive training in some of the other parts of the country it's really important. It's a big part of what we do at the tour. So, yeah, tour's in full swing. Caleb's taught a couple classes. Mike Seeklander's been busy. Derek Poole, Lee Vernon, and we've got 10 instructors with me on the tour this year. So another 3 months, 2.5 months left. So anybody who's looking for training opportunities, to check out personaldefensenetwork.com. Follow the training tab. You'll see some of the videos, some of the updates from the training tour that have happened already, and most importantly, be able to take a look at the calendar and see what events are going to be happening in an area that you might want to meet up with me or one of the other PDN contributors and jump in on some training.
Awesome. And if people want to follow along with you on the tour, where can they find you on the social networks and internet?
PD Network, at PD Network is the best place for Instagram directly from Personal Defense Network, and then mine is at Pincus Rob for Twitter and Instagram, and Rob Pincus or Rob Pincus Pro at Facebook.
Awesome. How was the NRA annual meetings?
NRA annual meeting was great. Missed you there. Had standing room only like we normally do on Saturday for presentation, about 600 people in the room. We probably had about 3,000 people come through all the various seminars that we put on over the weekend. Had a big group of combat focus shooting instructors from around the country there interacting with a lot of the attendees. Of course, we had a lot of our representatives from Personal Defense Network, hung out with a lot of our sponsors, Crossbreed, Springfield Armory, Breakthrough Clean, CMMG. They were all there, of course, Benchmade knives. We had a really cool custom knife made at the Benchmade booth that we're going to be giving away through Personal Defense Network to, we haven't exactly figured out what we're doing. We're going to have a contest, I know, coming up soon for either our members or maybe just everyone in social media, but it's really cool. Benchmade has a program where they will custom make one of their Griptilian knives, kind of your color scheme. They'll even put your logo on it, whatever you want done. And they actually were doing that at the NRA booth, which was super cool. But NRA is always a big deal. It's really become one of the highlights of my year, just because it's so cool to hang out with people who've been watching DVDs or watching PDN for so many years, and now they know to come and expect to meet some of the other instructors, meet some of the other contributors that they've seen when they come to my seminars. So it's really a great time.
Awesome. Well, you've been quite busy, and thank you so much for joining us on your 1 week off the entire year, practically. So we'll move on to our special guest tonight, Caleb of Lone Star Medics. Caleb, why don't you tell us a little bit about yourself and how you got into your line of work and what you do?
Sure. Well, you guys, thanks for having me out here. This is actually a pretty cool thing here. I guess it got started in high school, actually. It started the Boy Scouts of America, the Explorer program, and I started riding out with the MedStar ambulance service out of Fort Worth, Texas, through my junior and senior year in high school. And what started, that really kicked it off for me. I was like, oh, wow, this is really cool, riding in the back of an ambulance, and then it went on to the Army after high school. After high school, I joined the Army. Did 4 years as a combat medic there. Was stationed overseas in places like Germany. Then from Germany, went to 2 tours in the Balkans. Came back to the States. Finished up my career, illustrious career, 4 years at Fort Polk, Louisiana, with the 1st of the 509th and Parachute Infantry Regiment. And we somehow or another, a friend of the family said, "Hey, come out to the fire department if you're looking to hang out and meet some buddies of mine." And so I did, and got on the fire department. Spent about 6 years there. During those 6 years, I worked on with the engine company. I worked with the dive team. I worked on the ambulance crews, and also I was fortunate enough to get asked to a tryout kind of a thing with the SWAT team, and actually got to join the SWAT team not as a peace officer, but as their medic for about 6 years. And then here we are about 6 years ago this last month, or February, was down in paramedic school and started, they said, "Hey, you're catching on this stuff, and you're pretty good, you're a funny guy, why don't you come back and teach?" And I said, "No, I don't want to come back and teach you, I just learned this stuff." They managed to take a 14-month course, cram it into about 3 months, and that was a horrible experience. But I got through the class and went through a bunch of instructor development classes and learned how to teach. And came back. Some buddies at the shooting range said, "Hey, well, now that you're a big shot instructor, why don't you teach us some first aid?" And taught some of the ROs a basic 1-hour class of stuff I thought that was important. And here we are 6 years later with, working with people like, PDN, the other contributors, and traveling all over the states with about 20 or 30 different classes geared for, I guess everybody really, as far as soccer mom and dads, average Joe citizens to law enforcement, military. We really run the whole gambit as far as courses, but it's I'm still very much a student, though. It sounds like, oh, the guy's been there and it's some cool jobs here and there. I've met and worked with some really cool people, but I definitely don't know it all. But very much a student first as far as medicine, absolutely.
Awesome. And if people want to find you online or on social media, where can they find you?
LoneStarMedics.com is the website. We've got a Facebook page going as well. Rob has actually convinced me to get back on Twitter and Instagram, and I'm not sure, but my wife has introduced me to Pinterest. I'm scared to death to get on Pinterest. That is for guys with a beard, we're not allowed to say that, though, that we're on Pinterest, I don't think.
That is awesome. Well, everybody, like we said, we gathered some questions ahead of time, but if you have any questions to ask Rob or Caleb during this PDN Live Hangout, feel free to go ahead and type it in the comment section below, and we'll do our best to get around to them. And if you like what you're hearing, like what you're seeing, we have a free newsletter. You can sign up for it in the link right below in the YouTube description. You can visit us online at personaldefensenetwork.com. Facebook, find us there as well. Twitter, our handle is P_D_N, and on Instagram, PD Network. All right, so let's jump right into the topic of emergency medicine. So Caleb, a couple of people asked a very similar question. What items should a medical emergency kit contain for the average person? There's so many different kits out there with various things in them, but what do people really need to keep in their home? People have tried to put together their own kits, but they don't know if they has the right contents in it. So are there any good pre-made kits to buy, or any good kits for someone on a budget? Put together your own? What do you think?
Sure. There's, excuse me. It is a good question. It's actually a question we do actually get asked a lot in our courses and our classes, and over the years I've tried to answer the best way, and it's kind of a objective way of my answer is always the same thing, and it's there's 4 things you need to look at, and I asked my answer is a question back at them is 4 different things. First off, 1, let's look at our mission. What is our daily activity or daily mission? What are we doing today or tomorrow? What is it that we're going to be doing that we may need a first aid kit or some type of individual first aid kit or IFAC? And what type of, are we driving to work? Do we have a 30-minute commute on the freeway, and then we go upstairs to the 18th floor, work in the cubicle, come downstairs, drive to the gym, and then we are at the gym for 45 minutes, and then we have a hour commute while we're doing, soccer practice and taking, kids to violin lessons, and then I go home. Or am I kicking in doors of bad guys overseas or something? Or am I a patrol officer that's working the streets? Every one of those missions is a little bit different, so our equipment is that we're going to be carrying with us or in our vehicle is going to be a little bit different as well. So first thing's the mission. Second thing is excuse me, your environment. What type of environment are you going to be doing this stuff? Well, if I'm in traffic all day, I'll be in a vehicle. Okay, well that helps determine a lot. So I am still exposed to some type of elements. It may be raining that day. This winter across the U.S. we saw a lot of bad storms, a lot of snow and ice. And then, in the summer, well, it's 120 degrees outside. Okay, well, we might need to start thinking about carrying a little bit extra water with us in our vehicle or something. But our environment's just as well. Do we, are you someone that lives on the ocean to where you have to worry about salt water? Some friends of mine, I noticed that living up north, they have to worry about salt actually tearing up their vehicles and tearing up other parts of the equipment that's exposed to the environment throughout the year. So, okay. Third, though, is look at the level of training that you have. So, and this is going to kind of segue maybe later on, and I'll come back to, hey, we're number 3. But as far as what needs to be in my kit, as far as what is my level of training? Am I a layperson that has taken a, American Heart Association or American Red Cross first aid class? Or am I a actual trained physician? Well, depending on if you're in that gray area in between there, well, it's not gray area, it's a lot of in between, physician or the layperson. But what is my level of training? Meaning, am I going to be carrying equipment that I have no business having and keeping? Do I need a chest tube set in my go bag? Well, maybe not necessarily. And then the fourth thing is the number of people that I'm going to be immediately responsible for. So if I look at it and say, well, yes, I want to be a good guy and a good person and try to help as many people as I can, then I need to go back to the ambulance and start driving around an ambulance and 3 or 4 ambulances. But if it's just me and myself, my family, my loved ones, then say a family of 4, okay, then I'm worried about 4 people. If I've got, then that helps determine how much equipment and how many of these, toys and tools that we're going to have to be carrying. So it's kind of those 4 things. 1 is mission, or what is my daily activity or activity that I'm going to be doing. 2 is the environment that I'm going to be conducting that mission or a daily activity in. 3 is the level of training that I have. 4 is going to be how many people I'm immediately responsible for. Now, that being said, are there some, are there kits on the market? The second part of this answer of mine is yes, there's different kits on the market. Some are better than others. You can go out and build your own. I mean, you can go to a dollar store if you have to, and and I try to tell people not to do this because I don't want people to have to plan to improvise your medical equipment. Think of it as just like your personal defense plan. Well, I'm not going to improvise using a rock and sticks as my go-to primary defensive tool. No, I'm not. That's silly. I have carry my defensive pistol with me, my firearm, and flashlights and spare ammo and that sort of thing. I'm not planning to improvise it. Same thing with medical equipment. But you can, there's different kits in the market. We've got a few kits that we've been trying to playing around and toying around with. There's plenty of different companies out there that have them. People like Tactical Medical Solutions, they've got some pretty good prefabricated kits. There's, plenty that are out there. But some things that I would look for in your kit are, 1, the tourniquet. Mm-hmm. We can talk about that later. But things like a tourniquet, yes, tourniquets are a good thing. And you need to use them. Your pressure dressings, whether we're talking about chest seals, stuff like that. Things you don't want to put in there, and this may be easier to understand, are stuff like your Band-Aids, Neosporin, or your antiseptic wipes, your tummy medicines, just like Tums. That's all sick call stuff. That's an old military term, meaning it's not stuff that's immediately life-threatening. For some of us with acid reflux, we beg to differ. But for the most part, Band-Aids and the boo-boo stuff, leave that out of the kit. Leave that for your home first aid and stuff like that, but not your individual first aid kit.
Gotcha. Rob, do you have any thoughts on having a medical emergency kit for the average person and what the content should be, or if they should put together the kit themselves or buy one off the shelf?
I mean, the reason that Caleb's a PDN contributor is because he's the expert. He has that vast knowledge. He also works with a lot of different people. When I deal with the people that show up at the range or people that just, the average personal defense network member, I always tell them, two things, and I think that they were in what Caleb said. I try to simplify a little bit. If you're, first of all, the range kit, as Caleb said, should be very different from the everything possible kit, from Band-Aids to tracheotomies. So that range kit for me is a tourniquet, compression bandage, and hopefully you know how to use both of those pretty easily, and then also a hemostatic agent that you should know how to use. And that's kind of where I leave it, is you need these two things, maybe the third one, and the third one is one you need to go out and learn how to use. Obviously you need to know how to use the tourniquet, the compression bandage properly also. And that's probably an oversimplification, but those are the three things I want my students to have on there. If they have more training, great, have another bag somewhere else, and that other bag may have all the decompression needles and airway, everything else you can throw in the mobile surgical hospital kit that you want to drag around. Put that in some other bag. And then the thing I learned from Direct Action Medical Network years ago was, if you're traveling, and I travel constantly, it may not be a horrible idea to put like that major medical stuff on the one side of the bag and then put the everyday stuff, the Tums, the Band-Aids, your daily medicines, your prescription medicines on the other side of your bag, because if you travel like me, you're always going in and out of the vehicles, in and out of the car, in and out of the hotel room, and it's real easy to start losing things. Well, if you have your daily kit that you go to for your prescription medicine or your Tums, well, on the other side of that bag is where all your trauma emergency stuff is, so at least well, 12 hours ago I knew where it was. It'd be easier to find, because in their everyday life it's not always that easy to have your Molly gear, plate carrier stuff that a lot of people bring to range.
Awesome. Well, I think you guys definitely answered that for everyone. We had quite a few people asking that. And for those of you that are just tuning in, this is PDN Live. Topic tonight is emergency medicine. We have Rob Pincus, Executive Director of Personal Defense Network, and Caleb Causey of Lone Star Medics. If you have any questions during this, just type them down below, and we'll try to get to as many questions as we possibly can. So Rob, on the topic of training, Dennis asks, I've taken first aid, CPR, as well as an excellent tactical first aid course. In discussion with others, we all agree that knowledge retention is problematic, kind of the use or lose it type scenario. I can train regularly applying a tourniquet, but not sure how to meaningfully train for other life-saving skills. So how can someone take a class with Caleb and be able to retain that information, especially if it's not something that they use on a day-to-day basis?
Yeah, I'll hand that off to Caleb, but just some of the little tricks. It's not just the tourniquet, but the compression bandage. You can practice putting those on. The hemostatic agent, especially with something like a combat gauze, you can practice packing the wound. You can practice doing a lot of different things, including just your response, right? So, blow a whistle right now. Where's your medical kit? Where's your equipment? Where are you hurt? How are you going to respond? So I feel like there's a lot you can do if you just kind of sit down and think about what the most likely scenarios are and what those emergency situations you want to plan for are. Caleb, you help people with this question, I'm sure, at the end of every class when they say, how should I practice? What do you tell them?
Well, I kind of look at it as, okay, what is as dry firing? And this may sound kind of, work with me on this, but think of it as like a dry fire practice. Where can I apply this? Well, okay, well, just like you said, Rob, what's applicable? And that's really important for me as far as medical, because, yes, we can have, we're wearing plate carriers today or jeans and a T-shirt. I want to make it applicable. So simple things like, hey, when you and your family pull up in the driveway, in the afternoon, and you're at your driveway, maybe hand somebody in the car and say, hey, here's the tourniquet. Apply it to your brother or your sister or to mom in the front seat, because that, and just see how and time them, and go for a par time, and out of the family of four, see what's the average time, and use that as your par time. It could be something just like you said, watching TV. If you're watching this right now, turn to the person to your left or right, and if you've got a tourniquet or your pressure dressings, and everybody thinks, oh, pressure dressings, You know, that's simple. But like you said, Rob, you've mentioned it twice. There's a lot of different pressure dressings out there, and everybody wants to leave them packaged up, but they get a little confusing if you've never opened them and used them. But simple stuff while you're watching TV. Hey, if that crazy one commercial, that one product keeps coming up, well, every time it comes up, see if you can beat the commercial before the commercial's ended and apply that pressure dressing. Simple things like that. The more creative, you know, it doesn't have to be complex, but the more simplified it is, I think the more the people you're going to, you know, you as the viewer, you're going to do it. You know, it doesn't have to be a complex deal.
Gotcha. So, Caleb, we got a live question here on YouTube from the comments below. Has it been hard to get the tourniquet worked into the civilian emergency medicine environment? And does it help that it has been proven safe and effective during use in the military for the last 15 years?
Yes. As far as the short answer is yes, it has been a little bit difficult. I'm not going to throw anybody under the bus, but sure, you know, people are, you know, hesitant about what they don't know. And just like any other industry, sure, there's big egos involved, or that, oh, I don't know. I've literally had you know, 2 doctors in major hospitals and this was about 4 years ago, that told me, yeah, I would not want hemostatic agent used on a patient that you were bringing in here because I don't know how to debris it. And I looked at the, you know, meaning before they go to the OR, they have to clean all the bad stuff out, and because they don't know how to clean the wound, they don't want me to use that life-saving tool. And I looked at them kind of perplexed, and we talked a little bit about it, and they've changed their ways. But even on EMS with carrying on ambulances, I know that a couple of years ago that the National Association of EMTs and National Registry of EMTs, National Registry has started implementing and started actually adding to the curriculum tourniquets. You know, and it's actually questions on their exam for National Registry, stuff like that. There's a block of it in some of the textbooks, so it's slowly but surely getting there. I would also almost say that even law enforcement is actually picking it up quicker than you know, your typical EMS provider. That's not, again, it's not a knock on anybody or anything. It's just, you know, law enforcement seeing it. Hey, we need something. We need a tool here to make this work, and we're lacking in this training. We're having officers get hurt and car wrecks and everything else. They get hurt, so they're picking it up. And EMS is with the hemostatic agents, the chest seals. You know, with 2 wars on 2 different fronts for over a dozen years. Yeah, that stuff. So we can take some of the lessons learned there and apply them. They're not all applicable, but you know, trauma is trauma, bleeding's bleeding. So we can take the lessons learned from there and apply them here. Absolutely, we can.
We've had a lot of questions on hemostatic agents and quick clot. Do you want to kind of briefly go into breaking down what they are and how to apply them? We had a lot of questions just on kind of the basics around that.
Sure. It's you know, hemostatic agents. Let's, I guess, I'm trying to think in a nutshell. What is it, and what does it do, and how do we use it? Okay, sure. Usually that's about a 2-hour block of instruction, so I'm going to try to do it in about 60 seconds. No, what it is there's these agents, okay, and they are designed to assist or accelerate the clotting factors, if you will, of the hemoglobin or of the body, you know, of the blood. And I'm not going to break it down into the cellular level right now, but it assists it, and it doesn't cauterize. Some people think, oh, it burned it, and no, that's not. It doesn't cauterize. That's a side effect of some of the older versions. Okay, we're talking 4 and 5 years ago, but what it does is just help the blood clot faster and clot. So the way we use this stuff is you can, to maximize it, and to make it the most efficient and effective, is actually pack the wound. So there are certain places on the body that we don't want to use or pack a wound or use a hemostatic agent. There's other places in the body that we can. So let's just say a leg, okay, the thigh muscle, okay, or the upper leg, the thigh, between the knee and the hip. That area, say we've got a gunshot wound, and there's a hole there. Well, if it's high enough to where we can't apply a tourniquet, then we need to think about using a hemostatic agent. Hemostatic agents, stuff like Quick Clot Combat Gauze, Celox Rapid, those are good tools, but I don't want people to think, hey, that's the cure-all. Oh, I went to my local sporting goods place and bought this package of Quick Clot and throw it in my glove compartment and I'm good. No, 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 it doesn't quite work that way. You don't do the same thing with your personal defense firearm, do you? No. So the way this stuff you use it is actually we'll pack it into the wound. Now there's pros and cons to actually sticking your finger blindly inside that wound. One, you may cause obviously more damage by tearing up that wound site, the actual wound. But two, you've got to worry about, well, if that was a projectile like a bullet, well, there may be fragments of bullet, there may be fragments of the patient's bone, someone else's bone, other fragments from debris that followed the bullet in or were pushed in, whether it's glass or metal or other fragment debris, just debris in general, that may be sharp and start cutting up your own fingers as you're packing it. So there's some caution. You need to use some caution when doing it. But the idea is to actually at the wound site for, I would say, major bleeding, and that's kind of subjective, but bleeding to where hey, I can't put a tourniquet on, and let's say it's saturating a pair of jeans, okay, just for demonstration purposes here, you'd actually start pushing this agent down inside there, and there's a certain correct form and skill to actually packing a wound. But then don't forget, just because I packed that wound now and I've tried to create and fill that hollow space of that permanent and temporary wound cavity, well, now I've also got it takes a little bit of time. Now, Celox Rapid and Quick Clot Combat Gauze, both products have their pros and cons. Think of it as Ford Chevy. And like Quick Clot Combat Gauze, well, it may take 3 to 5 minutes of direct pressure once you've packed the wound correctly and shoved it down into that wound site for it to actually to work 110%. Where other Celox Rapid, I think it's a little bit less time, but they're just different products. I want to start splitting hairs there, trying to compare out apples there, but they're both great products. There's a few other products or manufacturers out there. How do I want to word this? They are good again, but they're not your cure-all. It definitely takes there's some places in the body you don't want to start packing like the skull fracture, or say I've got a hole, some type of trauma to the head. Well, I don't want to start packing into my brain and start smashing my brain up inside my skull with this gauze, with any gauze, hemostatic or not. Mm-hmm. So there's certain areas in the body that you have to be cautious of as well.
So we got a live question in the YouTube comments below on this topic of learning how to use these clotting agents. How young is too young to teach these skills? This viewer has a 10-year-old and an 8-year-old, and they just want to teach them to know where it is and how to apply some of it. What's your thoughts on that?
On training for the hemostatic agents, or just training for the medical part?
Let's just go with the quick clot that the average person has in their kit and they're with their kids. When should they start teaching their kids to use that, or how should they go about to do that, or is there too young of an age for that?
I would say, I'm not a parent, but I would say that really depends on the parent themselves. And what they feel like they're going to know their child, and what their, I guess, I'm trying to get what the word, their attention level is going to be, but also, as far as them getting it, what they can, okay, they understand the why portion, like, hey, just don't do this arbitrarily. Hey, okay, if there's bleeding, you shove this in there. Let's start talking about a little bit the why. They need to know when to do this stuff as well. We've had kids at our conference and also in our classes as young as, I want to say, the youngest in a Medic 1 class was, I want to say 11, and her father was in there. They hunt together. There was actually 2 sisters and their father, and the oldest, I think, was maybe 14, but the youngest, I think, was 11 or 12. And but they go hunting with Dad, and so they said, well, actually, they told their father about the class and said, well, if the old man trips and falls out of the deer blind, well, then we want to be able to help him. But I would really say it's up to the parents. But as far as using the hemostatic agent, there's no, there's not a set age group. Sure, you don't want to give a 5-year-old this stuff, or some 2-year-old, obviously. But I would say it really depends on the child, the maturity level, what they're capable of learning.
Awesome.
I don't know if I answered that fairly or not.
I think you did. So for those of you that are just tuning in, this is PDN Live. Topic is emergency medicine with our guest Caleb Causey of Lone Star Medics. And we have Rob Pincus, Executive Director of Personal Defense Network. If you like what you're hearing, we have a free newsletter. Sign up for it in the link below in the YouTube description. Also, if you have any questions during this, just feel free to type it in the comment section and we will do our best to get to them. I know we have a lot of great questions tonight. So Rob, you practically live out of your 4Runner on the PDN tour. Vernon asks, what all should I carry in my car in case of emergency? So what do you have in the PDN tour vehicle in case of emergency?
Depends on the kind of emergency. I've got all kinds of things. As far as a medical emergency goes, I've got my trauma kit, the same one that I would have on the range. That actually attaches when I come off the range. It lives right behind the driver's seat, so it actually just lives right there, and I know exactly where that is. I've got a second kit, which is one of those direct action medical type kits I talked about earlier, which is set up for daily use and a whole plethora of emergency and non-emergency medicine mixed into that, separated into 2 different areas. And then I've got this one orange bag that kind of stands out from everything else, and that is my, a car in front of me just rolled off the road, kind of a grab that bag and go. And kind of like Caleb talked about, that's the bag that has multiple tourniquets, multiple setups of gauze, multiple compression bandages. That's really the one that's set up for, there may be 2 or 3 people. I may be taking control of a scene and, here, do this, do that. So that one's set up with a lot of depth. And that has some other specific equipment, safety cutters. All my bags have the Benchmade safety cutters on there to get through clothing or to get through seatbelts. That's the major stuff. And then there's another bag. So I think the 4th bag now inside of the vehicle, and that's the sunscreen, Band-Aids, aspirin, ibuprofen, kind of boo-boo, bad day at the range, stomach ache. It's got that kind of stuff, which also, I primarily have it there for everyone at the range as the kind of the guy hosting the class. But I use that stuff too, and certainly on a daily basis use that to restock that direct action medical network kit. So there's a lot going on just in terms of medicine for emergency response in the PDN tour truck.
Gotcha. Caleb, do you have any thoughts on the average person having a emergency kit and what? I know we kind of covered it a little bit earlier, but anything to add to that?
No, I agree with what Rob's saying. You've got, and I hate to use a cliche, I've got different tools for different jobs. Okay, in my toolbox. Now, obviously, the tour truck is, we've got, I'm sure, plenty of tools and toys inside it, as Rob said, depending on the emergency. Yes, people need to have this stuff with them and on them. In a vehicle is fine and great. Number 2 killer in America, according to the CDC, is blunt trauma. And if you dig more into their statistics, it comes out to be motor vehicle accidents or collisions, just because of the sheer number. Okay. Now, granted, heart attacks before that. So, okay, should everybody be running around with automated external defibrillators in their car and in their pocket? Sure. Is that really, possible right now? No. Are those devices expensive? Yes. But you're finding them all over. But the same thing with your medical equipment. If you can keep it in your vehicle, or better yet, make it part of your everyday carry, that's a great option. At least there, I mean, if you've got, just take for example what Rob said he's got a tourniquet, a pressure dressing, hemostatic agent, and I think Rob, you said you've got maybe a couple chest seals in there. Is that correct?
In the blowout kit, I carry one of them that has that plastic insert inside of the wadding on the compression bandage. So I keep the chest seals are in that secondary kit, the orange one.
Right. I mean, if you just take a pressure dressing, depending on your pressure dressing, and it's shameless plug, but the TapMed Solutions Elias bandage, that thing's like 5 bandages in one. So if I really am, know what I'm doing here with this one bandage, I can treat up to either 5 different people or 5 different injuries. Now, it may not be the most effective or efficient device that I use or tool that I've chosen, but at least just with that I can. Same thing with, just a simple triangle bandage. That might be in your boo-boo kit in that orange bag that Rob was talking about, the larger kit. Just a simple triangle bandage or a cravat. In the military, I mean, you ask any combat medic, or corpsman, what do they think about triangle bandages, and that's 1,000,001 uses just right there. But it's yes, it is important that you should have something on your body as part of your everyday carry, and definitely something in the vehicle. Absolutely out there in the range. Absolutely out there in the range.
And I think something that Caleb just brought up is important. Not going too far off into the weeds, but this is why the training's important. This is why the DVD that we did with Caleb's important. This is why going to one of Caleb's classes or any of the other guys that are doing good work, going to one of these classes on emergency or what we've started calling self-defense medicine is incredibly important, because that olease bandage is the one that I carry around. And I know people carry around and don't even know what's in that package. Like, as Caleb alluded to earlier, they've never opened it up. They don't realize the package itself might be useful. They don't realize, even with an Israeli bandage, that the package itself or the sub-package could be useful. There's all kinds of stuff going on there that if you know what the quote-unquote tricks, and it's really not tricks, it's the way these things are designed. They're very sophisticated, but they seem very simple. I'd much rather have the olease bandage with somebody who knows what they're doing if I have a punctured chest than somebody who's carrying around 4 chest seals but has no idea what they're doing, but they were told to carry a chest seal around.
Gotcha. So we're going to change gears here. Rob, we had a question asked a couple times by a couple of viewers on what are your thoughts on administering critical care to a bad guy that you shoot because you were attacked by him, you had to defend yourself, you were in fear for your life. Do you think... It's a non-issue. In personal defense world, it's a non-issue. You need to stay away from the bad guy. There's no, if you have a moral, ethical issue that's pushing you forward, that's outside the scope of my professional advice. My professional advice says you don't go near the bad guy. People have to understand that far too much information filters from the law enforcement environment into personal defense context without really being thought through critically, and we just assume, well, what the cops do is what we should do. The gun the cops have is the gun that we should have, and that kind of thing. The tactics that law enforcement uses are what we should use, and our job is to stay away from the bad guy. The law enforcement officer's job is to control, stop, capture the bad guy, and it's considered it's a Fourth Amendment issue. So if you injure someone, you take someone into custody. Once you seize them, once you've used that force, they're down on the ground. You're now responsible for them. You've now taken custody for them, and that's where the issue of a law enforcement officer providing care in that environment comes up in a way that's very, very different from personal defense. Caleb, your thoughts?
No, I agree absolutely with you. As far as a personal defense, as a self-defense type of deal, hey, I'd keep my distance. I'm not there to render aid to them necessarily. I'm more worried about myself because you're going to be think about it. If you're carrying just your everyday carry medical equipment, well, that's going to be very minimal equipment you've got on you during that. So during a altercation or a fight, there's usually more than one person injured. At least one person. And if you stopped your threat and they're no longer, they're neutralized to whatever extent, but then say your family members or yourself, students in our classes realize real quick just how quickly those limited resources are eaten up on one injury. Now, sure, we said earlier, just said, well, if you've got that one bandage, you can get like 5 injuries out of it. You can, but they're not going to be most effective and efficient. So, yeah, priority one is your personal safety, then your loved ones, and then bystanders, and then maybe you're not the bad guy. But yeah, I would say keep your distance, absolutely. I would have no obligation to rendering aid to them. Law enforcement, like Rob said, I think is a little bit different issue, and I'm not the subject matter expert on that. I would go with what Rob, if you've got anything as far as for law enforcement, that might be another rabbit hole to go down. I don't know.
Yeah, we'll save that for the Law Enforcement Defense Network video.
Perfect. I'll write that down as another topic. So, Caleb, how would you compare treating a knife wound to a gunshot wound? Kind of like from the bleeding to bleeding control to bandaging. And of course, this is all dependent on location, injury, scenario, blah, blah, blah. But maybe let's take that scenario of you were injured in that confrontation. So whether it was a knife wound or a gunshot wound, how would you go about treating that?
Well, first, yeah, I mean, first things first, and no matter what the mechanism of injury is, first is scene safety, so to speak. But let's say that, yes, we have, in our little scenario here, yes, we're in the parking lot, the threats either ran off or no longer a problem, they're neutralized. So now it's safe for us to start actually rendering aid to ourselves. I'm not so concerned about what the mechanism of injury is, what caused that injury. Sure, there's going to be a little bit different with, as far as energy transferred and kinetic energy. If we've got something with velocity like a bullet or a projectile, or versus say a puncture from they're both penetrating trauma. But as far as it being just a stab wound, I don't want to just say stab wound. Well, that's not so bad. Well, there's some pretty bad stab wounds out there. Each present a little bit different trauma to the body. High velocity may have a little, tear a little bit more up. You've got that temporary and permanent wound cavity going on. You've got pressure waves involved. A lot of damage being done very small in a small part of the human tissue or the body. But it's maybe happening very vital. If they happen to clip an artery, well, that could be pretty life-threatening and pretty bad. Stab wounds are not to be overlooked either. There's plenty of people that have bled out and died from stab wounds, and multiple stab wounds. So as far as treating them, sure. I don't want to say bleeding's bleeding, but we kind of have a saying, and it doesn't necessarily apply to this. It's more of a, hey, or our equipment, but the saying goes, we treat our patient, not our equipment, and meaning, hey, let's not, just because on the heart monitor says, hey, we've got a pulse rate, we look at the patient and no, they don't. So same thing here. Just because they were stabbed, and let's focus on what caused that injury. Well, yes, let's make note of it, but let's not get too wrapped up whether it was a stab wound versus a bullet wound necessarily.
Got it. So, Rob, you might have insight on this next question, but Caleb, feel free to chime in as well. Robert asks, on the ranges I frequent in the Southwest, the most common emergency I may encounter is heat stroke. Is there a way for me to spot someone headed in that direction even while they may be in denial? Rob, I'm not sure if you encountered this teaching.
First of all, I don't handle people in denial about anything on my range very well. So they're more likely to have a psychological issue if they try to be in denial about things in my presence on the range. But Caleb, from a medical standpoint, go.
Let's see, dehydration.
I'm hydrating as you talk about this.
Yes. Well, I see you two are drinking your bottle of water. That's good. Doesn't matter what. Do as I say, not what I'm doing. Okay. Don't call me out on this, guys. Okay, but dehydration. Sure, out on the range. Dehydration in 15 years of being a medic, guys. Dehydration is the #1 most common injury I've seen. It's also happens to be the hardest to treat in the field, meaning at the shooting range, or maybe at the kids' football game, or while I'm out mowing the lawn, or doing whatever your daily activity. It also happens to be the absolute easiest to prevent, and that is just simply drinking water, eating breakfast, lunch, and dinner. I'm not going to get into the whole nutritional value, but just eating food, but just also just drinking water, being hydrated before. So hey, that on Saturday I'm going to go out to the shooting range to this class for the weekend, or do some skills practice. Well then, hey, maybe on Wednesday you start drinking water and get hydrated and get caught up on all your fluid intake, and you start thinking about, hey, what I should probably take some some food, some sandwiches or something with me to the range, so that way, one, I can stay on the range and maximize my time, but two, I'm eating too, because we get a lot of our electrolytes and minerals and vitamins and stuff from the food as well. But just being hydrated before the event starts. because you start getting thirsty, you start getting those headache and nausea, and you start feeling bad, and your blurred vision, or you start passing out. That's really bad. Then it's too late because now it's hard to treat. I can't just give you an IV and you suck down a liter full of lactated ringers or normal saline, and you think, oh, I'm going to be fine. No, it's going to take days for your body to recover, and it's going to take gallons of water for you to sit there and sip on. It just takes time to treat it. So absolutely, yeah. I mean, but the signs and symptoms of dehydration, the early signs would be simple things like thirst, dry mouth, maybe a little bit of a headache, maybe your tummy aches, a little upset stomach, and it just kind of escalates. You can get the bad thing is you could get one of these signs and symptoms, or you could get all of them, and you can get them in any order. Some of the more serious ones would be obviously, just for your skin, for example. If you don't feel your own skin, because, well, that's your own skin. You've got to ask your buddy to do it, or your shooting buddy, and say, hey, feel each other's forearms. Does the skin feel hot, and is it warm and moist and wet? Okay, is it hot and sweaty? Okay, that's a good thing. Sweating's good for the body. Bad part is when it starts feeling kind of cool and clammy. So if you grab your buddy's forearm and you're like, wow, it's not hot, it's actually cool and feels like a fish that's out of water, kind of a cool fish, then yeah, that's a bad thing. You need to, hey, let's go inside or get out of this hot environment, start sipping on some water. So bad signs and symptoms would be obviously they start, going in and out of consciousness, meaning they start blacking out, fainting on you, or they get confused. They're like, you can tell their body language when they start walking back to the car, they're walking back to another car, or they keep, hand-eye coordination obviously starts deteriorating. But when they start passing out at that point, and their skin happens to be hot to touch, and it's dry, then that's a bad thing. That's definitely, if you haven't done so already, a 911 type of deal, and not only just say your day at the range is over, people are dying because of that, and it needs to be dealt with quickly. But you can prevent that stuff so easily just by drinking water. That's all I'll say there. I'll get off that soapbox for drinking water.
It is Caleb's mantra, and I've stolen it. You ask anybody who's been on a range with me in the last, I don't know, 2 years probably, since it became kind of the running joke about Caleb saying it all the time. But it's also common sense. And when you think about it, like I send people back for a reload break and drink water 3 times. Now, I get it, like half of my class is not drinking water and half of them are, but not nearly as often as I say drink water, but it really is just too easy not to do.
Yeah. So, Caleb, we have kind of an interesting question here from Dr. Bill. He's the Firearms Chat podcast producer and host. He's a volunteer EMT off and on since high school for almost 40 years and recently had bad kidney failure and now is on dialysis, the at-home kind of dialysis, which is less involved, and the new home-based machine comes with a small locking case. Can this be toted within a large medical backpack in case of a bug-out situation?
Well, there's different, I'm not that familiar with all the different dialysis machines that are out there, to be honest. But I would say yes, I would treat it as for my own personal use. Yes, if I am on dialysis and I have some type of home machine that I can use or device, and that it's portable, and make that part of my prep, well, sure. And I'm sure those things, those devices are not cheap. But so it's not like you're gonna be able to get 3 or 4 of these things and put them around like you would a set of spare car keys or something, or a spare tourniquet. But you should absolutely, definitely make it part of your prep if that's something that you or your family member use, or a dialysis is part of their well-being. And sure, granted, your typical dialysis machine at the dialysis clinics, no, those things are gonna weigh 2 tons, and they're the size of a Volkswagen. That's not something you're going to actually be able to pack and put in there. But it's dependent on the medical kit in your backpack. Sure, if someone with that gentleman's background, they may carry a little bit larger kit than, say, John Q. Citizen. But in that kit, we'll just think, well, is it worth the cubic footprint of, depending on how large or small this machine is, and then everything else that's needed to support that machine. If it's battery operated, can I recharge it with a a solar panel? How do I keep stuff like that? Does it require any other additional medical equipment, tubing or catheters or alcohol prep pads? Just even little things like that. That's something definitely to take into consideration with making it part of your prep with any medical device.
I think it's closely related to the, you mentioned the AED earlier, and for the average person, it doesn't make sense for us to run out and throw it in the backpack or whatever. But there are people who they know what their cardiologist is telling them. They know the history of their family. They know what their health status is. Before you go buy that extra gun, maybe an AED in your vehicle or in your backpack is a good idea. If you know you're in that demographic. People talk about self-defense and safety and protection, and sometimes they just mean I shoot guns a lot. Having that medical equipment that you need and having it where you need it is, the most fundamental level of protecting yourself.
Absolutely, yeah. I mean, AEDs, are we getting there with those automated external defibrillators? We're getting where, hey, we could eventually put those in, say, a backpack-sized kit or a bug-out bag? Absolutely. Are they expensive? Sure. And we're talking your average AED. Let's say, and I always tell people, hey, the ones with less bells and whistles, the better. Funny how that works. Very similar, maybe, to a defensive firearm. Okay, but the less bells and whistles, but you're talking $1,500, $1,600. So yeah, maybe like you said, Rob, maybe not. Hey, I should go get a third and fourth defensive pistol. Let alone. Yes, everybody. We're all firearms collectors. We'd love to have all that one of each caliber. But instead of maybe getting that 6th or 7th AR, maybe with grandpa or your parents or your loved ones that your family, hey, they're having some heart issues, but they're still young enough and 75 years old, and they're still running around and everything. Hey, maybe out there at the deer lease or something, or hey, it's something to take on road trips with us in the car. That might be something you need to look into.
Gotcha. So we've covered a lot in this hour. Can either of you recommend a good handbook to keep handy for this type of thing on the topics we've talked about, something that could guide a novice through, the common emergency medical situations, in addition to where can they find additional training for combat medicine?
Sure. Absolutely. You can find these epic, I don't know if you guys can see that, DVDs that are really handy. It's not necessarily a book, but I've always got one on as part of my everyday carry. You guys need to zoom in on that one. I'm kidding. No, it's been really interesting because it's hard enough, we said earlier, trying to get EMS on board and trying people with things to learn and, find out that, hey, yeah, tourniquets are a good thing. But as far as a textbook or reference, it's still, no pun intended, kind of on the bleeding edge, unfortunately, of trying to, convince everybody to there's a need for this training. There's textbooks out there, but most of them are going to be at the EMT basic or paramedic skill level. So there's bits and pieces. Sure, you can look on the web, and yeah, at the risk of self-promotion, we've done a few articles there with PDN. Talking about a few things. We've got more coming. But as far as a book or a handout or a pamphlet or some type of resource or guide, I really don't have anything for you, unfortunately. I hate to tell people that, but it's not available yet. There's not one out there. Rob, do you know if anything in your? There's.
Yeah, I think to me what we were talking about, this emergency, immediate action, self-defense medicine, you have to know this stuff like your unarmed and your armed defensive skills. It's going to a class, it's learning the material, it's watching the DVD, and then practicing, going through those motions and owning it so that in the moment of need, you're not going to be looking at a pamphlet or a book, right? And that's why I stress the classes. As you said, the articles, the DVDs, those are great. I'll announce now that Caleb is our first outside PDN instructor who's come in to do a distance education course for us. We're going to be launching our distance education program with formal certificates and online learning and online testing and all that later this year. We do have an emergency self-defense medicine class that Caleb is done. We taped it here near where I am in Colorado. about 6 weeks ago, and he's putting the finishing touches on the tests and some of the other materials. That's going to launch later this year, and it's that kind of learning that has to happen and then be supported by the practice and the scenario training and all the other things that you want to do to own the material. That said, with my kind of prep bug out kit and in with one of those bags that I was talking about, the bag that kind of has the Band-Aids and everything else, I keep a small PDR for drug references, and I keep a small nurse's guide in there as well, because there are things that aren't emergency medical issues that if I'm out off-roading, if I'm at a remote range with a bunch of people, and there's other things, and then obviously you have that worst case scenario survival situation where you're trying to find anything that's an antibiotic, and having that PDR handy, or here's a pill, what's this do, which box does this go in for our emergency austere environment medicine. It's also helped traveling in third world countries when I've had to pick up medicine for something that we didn't have, and not knowing the brand names and actually having to go in there. So it's beyond my technical expertise in terms of emergency medicine, but I do have those types of references that I carry around when I'm going to be in those more remote situations.
Sure. There's, like Rob said, that physician's desk reference. Most of those books are huge books. Okay, these are not small books you're going to throw in your vehicle and carry around unless you got a pickup truck to carry this darn thing. But it's a great book. They have an app for it. I'm sure you can put it on your smartphone devices. But yeah, I'd say the physician's desk reference, a Merck manual, even a nursing guide. There's a couple different publishers that makes them. You can search those out. Those are good to have. You can usually find an expired one. Say you can find a 2013 or 14 nurse's book or nurse's guide at like half-price bookstores or something, and they're fairly inexpensive. And yeah, it's not up to date, but at least you've got something there. I'm trying to think of some of the little pamphlets that we carried as combat medics, like pharmacopoeia books. I mentioned Merck manual, even anatomy books. There's several out there, different levels. You can get simple stuff that's got a kid's coloring book as anatomy and physiology book, all the way to Gray's or Netter's and anatomy. That'll be good references to have maybe your house, flip through them. But absolutely, like Rob said, I agree. When injuries happen, that's not the time to actually flip back and start. Okay, go to chapter 2 and read up on that.
Well, Caleb, it sounds like you need to write a book.
Yeah, about that.
Well, guys, it's the top of the hour here. We have a lot of questions that we didn't cover, and those of you that are tuning in live, still hang out with us after this is over. Caleb and Rob will be hanging out, and they'll be answering questions in the comment section below, so please feel free to keep firing away the questions. Thank you, Caleb, for your time tonight on the topic of emergency medicine. And don't forget, we have that free newsletter, free. Everyone loves free. Sign up for it in the link below in the description. What else? Find us online, personaldefensenetwork.com, Facebook, Personal Defense Network, Twitter handle P_D_N, Instagram, PD Network. Next month, we have William April with the topic of dealing with violent behavior. Keep with us on social sites to find out dates and times. And for those of you who are tuning in after the show's over, you can go ahead and contact Rob and Caleb and reach out for questions. Rob, where can they find you online or social?
The best place to go with follow-up questions obviously is going to be right under this YouTube window, just in the comments, because we're going to spend the next 30, 45 minutes or an hour off and on. We'll jump in every, I'm sure 5-10 minutes. I'll be looking to see what's there. Most of the questions will be for Caleb. I know he's going to be there, which is great. So we'll answer some immediate questions. Further down the road, take a look at personaldefensenetwork.com. Hit the search window and put in the medicine stuff. You're going to see Caleb's articles. You're going to see some of the videos we've done with Caleb and myself. We had some other contributors over the years at PDN talking about medical stuff. Take a look at what we've got. Use the comment section there for follow-up questions. Or you can go to Facebook's ICE I.C.E. training discussion group, too, is a great place to ask questions. And Caleb can be tagged in there and jump in as well. He's got his Lone Star Medics also is a great place to find him, Instagram, Twitter, and I know you have a contact also at the website, right, Caleb?
Sure. On the website, lonestarmedics.com, go to the contacts page and shoot us an email. Those go directly to me. I see those, and I'll answer anything you got. And then, like you said, Rob, on the ICE Facebook page, and then also here, I'll hang on for 30, 45 minutes, and so down below on your page there, the YouTube channel, I'll skim through there and answer some questions.
And most recently, you can find him on Pinterest now.
Yes.
All right, guys, thank you so much for your time tonight, and thank you, everybody, for tuning in and all the awesome questions. Be sure to check us out online, and have a great night.